Says it's investigating a case of possible measles exposure at Pearson Airport linked to an international flight from Tokyo. This comes after a case was confirmed at a Montreal Canadiens game earlier this month. Joining me now with more is infectious disease specialist Dr. Lisa Barrett. Doctor, good morning to you. What do we know about the extent of possible measles exposure at Toronto Pearson Airport?
Well, they're defining a couple of hour period, about a 2-hour period. And as we realize, through Toronto Pearson Airport, there are a lot of humans that wander by in 2 hours. Measles is very distinct in that it stays in the air for a long time, even after the person is gone. And therefore, there's the possibility that there were a lot of folks who were around when virus may have been in the air. So extent, a lot of humans may have gone by. Hopefully, most of those people would be folks who are exposed but immune, but there may be some people out there who need to know about this and contact public health if they're not immune.
There have been outbreaks of measles in New Brunswick, Quebec, Ontario, Manitoba. The total case count for this year is 227 as of March the 6th. That's already more than 2024 rather. Why are we seeing these outbreaks, Doctor?
Well, this one we can all sit around and talk about all kinds of maybes, but the main driver behind this is that there's less immunity in the community, and that's because most likely vaccination rates have gone down, both related to COVID and because increasingly folks may not be getting vaccinated in their childhood. This was a disease you'll notice we didn't talk about a couple of it had gone away in Canada pretty much. And so with increased travel and decreased immunity, this measles virus is what I would call a super spreader. Its superpower is being able to spread. And when folks aren't immunized with an exceptionally effective vaccine, we're going to start to see cases of measles, and that means illness and deaths that we're going to see eventually in very, very young kids and other people that don't need to happen.
So if you believe that you've been exposed and you haven't been vaccinated, you say call public health. What can be done at that point, doctor?
Yeah, there are various different things that can be done. Of course, one of the big things is to make sure that other people aren't infected around that person, but also for their health, there's different approaches to making sure the person has the right medical care. There can be ways to limit your exposure through either a vaccine within the first couple of days after exposure. And for certain very specific individuals, there may be some other products that you can give that boost immunity quickly. So there are options, and really important to reach out to public health, both for that person's own health as well as that of the people around them. So a really safe, easy, and free way to make sure people stay safe is to get vaccinated.
Yeah, and let's leave with that message from you, doctor. What do you say to those who are still hesitant to get themselves or their children vaccinated?
Yeah, and you know, people should ask questions if they are worried or concerned. But really and truly, if I was headed out today, because there's measles in many places, we all love to travel these days. Now I have to look up and see if there are measles cases where I'm going. So really, I would tell people that I trust, as an immunologist and an infectious disease doctor, I trust the measles vaccine. It is safe. It's very available in Canada. We're very lucky it's free. And I know it works extremely well. One of the best vaccines we have. I would say go for it. Get vaccinated. Vaccinate your kids. It's a really great way to keep them healthy. And again, it's something that you can do for them that'll last a lifetime.
Dr. Lisa Barrett, thanks so much.
Thank you.
Right.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.